Hi, I'm Randy Yanda. I'm one of the gastroenterologists at Digestive Healthcare of Georgia. Today I'd like to talk about everyone's favorite subject, the bowel prep for the colonoscopy. If you're watching this video, it's likely that you're going to have a colonoscopy in the near future. You're apprehensive about doing the bowel prep, and you may have heard from family or friends that have had a colonoscopy how bad the bowel prep is. The prep is not fun. The prep is not as bad as it used to be. The volume of solution that you have to drink is a lot less. We split it up into 2 different doses, so it's a little bit easier to do. The purpose of this video is to give you some tips to get you through this process and explain to you why an excellent bowel prep during your colonoscopy is so important into getting a good examination. Getting an excellent bowel prep is a very important part of the colonoscopy. During your colonoscopy, what we're doing is looking for colon polyps. We think that most colon cancers start from a colon polyp. Now, it may take many years for that polyp to turn into cancer, but even polyps that are very small, in the order of 3, 4, 5 millimeters in size, can be precancerous. So you might imagine if your prep is not very good and you have some stool in your colon, it'd be awfully easy to miss a small polyp like that. We can, during the procedure, irrigate the colon with some tap water to try to clean it out a little bit better. But if there's stool in the colon that we can't get out, then we're uncomfortable with the fact that we may be missing some small polyps, so you may need to come back sooner for another colonoscopy. If you do have a poor bowel prep, it will also increase your procedure time. We'll try to clean things out while we're in there, but that takes longer. You're under anesthesia longer, which increases the risk. And if we can't see where we're going with the scope because of the stool in there, it can increase your risk of perforation of your colon. There are several different options that your doctor might prescribe in regards to the bowel prep, and we'll go through those in a second. One of the principles of doing a good bowel prep is being on a clear liquid diet the day before, and then doing all these preps in what we call split dose prepping. And what that means is that you'll drink part of the prep the night before the procedure, and the second part of the prep the morning of the procedure. In years past, we always used to use a large jug here and would have people drink the whole thing the night before. We found that splitting the prep up like that, evening and morning, you can actually drink less volume and it actually works better. One of the concerns patients have is that they drink the prep in the morning before the procedure and they have to have a little bit of a distance to drive to the hospital. Are they going to have problems getting to the hospital without having to stop and go to the bathroom? We found that drinking the prep 4 to 5 hours before the procedure in the morning usually gives you plenty of time to get the prep down and get all the prep out of your system before getting in the car. If you come from a long ways away, you can start up to 6 hours before the procedure. The morning dose also tends to run through you quite a bit faster than the evening dose. So if you can get that prep down as soon as you can in the morning, that will help get the prep through quicker, and so you don't have to worry about stopping in the car when you come into the hospital. These are the prep options that we typically use for the bowel prep. The first option is the large 4-liter jug. There's different brands, Go Lightly, Co Lightly. This is the old workhorse from years ago. So if you drink this particular prep, we want you to drink 2 liters in the evening and 2 liters in the morning. The downside of this prep is more volume to drink. The upside of this prep is it's generally the least expensive. It'll run you about $10 for the prescription. The second one is something called Movie Prep. That's the one I tend to use the most. And that is 1 liter of fluid the night before, followed by some water, and then 1 liter of fluid in the morning. This prep is safe for everyone, even if you have kidney disease or heart disease, as the big jug. The downside of this prep is that it can be expensive if your insurance doesn't cover it. Generally about $100 for the prescription. So if your insurance doesn't cover it and you don't want to spend $100, please call us and we'll prescribe something else. Another prep is called Su-Prep. It's a little lower volume, generally 5 or 6 ounces of the prep with 16 ounces of fluid the night before, same thing the morning of. And the lowest volume prep is called Prep-A-Pick. Tastes probably the best. It's just a small glass of prep followed by a lot of water. It also can be expensive, not a prep that you want to use if you have significant kidney problems or heart problems. But again, these preps all are engineered to be drank the night before and the morning of. The Movie Prep box on the back, it will say you can drink it all the night before. We do ask you to ignore those instructions because it does not work as well if you drink it all the night before. Not everyone gets a good result from these bowel preps, even though you've followed the directions, drank all the fluid. Not everybody gets completely cleaned out with these bowel preps. So let us know when you call the scheduler to schedule examination. If your last colonoscopy or prep wasn't adequate, let us know. There's other things we can do or prescribe. If you tend towards severe constipation and you're taking daily laxatives, please let us know. We might want to give you an extra prep. Also, if you're taking chronic narcotics for pain control, that will slow your colon down, so you might not get a good enough bowel prep. Some people use what we call a 2-day bowel prep, where we have you drink clear liquids for 2 days, have you drink some laxative 2 days before, and then do the standard prep. That often works well. We have a doctor on call every night. If things aren't going well, we want to hear from you. If you've drank the evening dose of the prep and nothing's happened after 4 to 6 hours, please call us. We got some suggestions we can give you to get things going. If you feel like you're very nauseated and you're just not being able to drink at all, please call us and we can call you in some medicine for nausea or give you some tips on how to get it all down. We don't want you to not call us and not drink the whole prep or not be cleaned out and come in the morning, because we want you to get that colonoscopy done. You've got the day planned for it. Your driver's here, they've taken a day off, so we want to make sure that you get a good exam when you come in. We don't want to turn you away and have you reschedule for another day. When you do come in the morning and check in and you don't think you're cleaned out completely, and by completely we mean we want that solution coming out of your colon to be clear. It's going to be a little yellow tinged, but you should be able to see through it. So if you're not clean, let us know when you check in, let the nurse know in the pre-op area. There are some things we can do in the prep area to get you even cleaner. We may give you a bottle of magnesium citrate in the prep area, have you drink that, delay your colonoscopy for a couple of hours to get you cleaned out well enough. And the nurses can observe, what kind of stool you're passing in the toilet. Don't drink anything by mouth for 2 hours prior to your colonoscopy. That includes the prep, that includes water, coffee, that even includes chewing gum. So if patients will come in drinking a cup of coffee or drinking some water, we need you to have that stomach empty before you get sedated, because once you're sedated and you have some fluid in your stomach, there's an increased risk of aspiration of that fluid into your lungs, and that might cause pneumonia. During the examination, your bowel prep is graded using the Boston Bowel Prep Score. You'll see that on the report that we give you. What we do is we divide the colon into 3 different segments and score that prep 0 to 3, 0 being unacceptable and 3 being perfect. And we give you a total score of hopefully 9, which would be perfect bowel prep. There is no 10. 9 is perfect. People look at the reports and see 9 and wonder why they didn't get a 10. If you get a 9, that's the best prep. That's what most people get if they do the prep completely. And that tells us, when we look at your report in the future, that we were able to get an excellent bowel prep and unlikely to miss any small polyps. I hope the information in this video is helpful to you when you're doing your bowel preparation for your colonoscopy. Please read your instructions well in advance so you know what to expect. Please call us with any questions. We want you to call us if you have problems so we can get you through this process. We want your prep to be excellent. We want you to have a good exam. So when we're talking out in recovery after your procedure and I tell you everything looked great and everything looked normal, we want to be both confident that we got a great examination, didn't miss any lesions that might give you any trouble before your next colonoscopy in 10 years.